So here we have asymmetry, and I'm using a suture technique because this patient's a good candidate with her thin skin and low natural crease goals. Here we are about 3 weeks later, looking very symmetric, looking nice, everything went fine. But for this next patient, it's a little bit different. I'm going to use a 5-hole technique on the left side. You can see my markings there. And I'm going to use a 6-0 Prolene suture to fix her new crease into place. Here she is the first week, swollen, not even, that's normal. The crease looks too high, and you can see the holes, that's normal. But here we are going into week 2, week 3, and we look very good.
So I just wanted to say a few things about suture technique. I like it. I think it's useful. I don't think it's for everyone. I think you just want to use it in patients who are younger, who have thinner skin. You can more reliably adjust a crease or make a crease for them, and it should last longer. Things that I think are shortcomings for suture technique: it doesn't last as long, it tends to come loose, it has a revision rate similar to incision technique, I think, but it's not as precise or as reliable as incision technique. I also feel like that the little holes that you make, the little windows that you make for the placement of the sutures is more visible than a well-heeled incision technique. And suture technique goes by a lot of different names: DST, DST, incisionless technique, scarless technique, 5-hole punch technique, 3-hole punch technique, depending on what country you're in or what language you're translating it into. It goes by many names. I think most of the names are actually very misleading. Incisionless technique and scarless technique are just totally false. I just don't think that they're accurate ways to describe the way that this procedure is done. But in any case, in certain situations, I think it's a very good choice for people, and these two patients I think were good examples of where suture technique could be used.